Africa has now lost nearly 3,600 people to COVID-19, and as the numbers rise, so do the economic and political tensions. Tonight, a perspective from the continent's women, including UN Women Executive Director Phumzile Mlambo-Ngcuka. Good evening, I'm Aldrin St-Pierre, and this is African Perspective. And we start here. African countries are neglecting sexual and reproductive health care as they concentrate all efforts at fighting the COVID-19 pandemic, pushing back gains that the continent has made in reducing maternal and infant deaths. This is a warning from the Africa Reproductive Rights Initiative, which says there has been a deprioritization of other areas of healthcare, putting women and children and girls as well at risk. Sarah Gemani has more.
The ongoing lockdown and movement restrictions have exposed millions of women to gender-based violence, especially domestic and sexual-based violence.
Due to the economic stress that families are experiencing with a lot of unemployment right now, it's also because of the restriction of movement. And so we are seeing that women and not having the social support networks that they've had in the past that have helped them to deal with domestic violence, for example, the churches and family.
Roughly two-thirds of global maternal deaths recorded last year were in sub-Saharan Africa. COVID-19 is likely to plow back gains made in the continent's bid to reduce these deaths.
Because of the curfew times, we have seen that many women have died who would not access health facilities because one, they did not have transportation to the health facilities, because if you look at the taxis, if you look at local means of transport, they are not traveling at that time, and therefore women have died in their houses. They have bled to death during delivery.
So that when countries restrict movement, women cannot access healthcare facilities. When countries have diverted resources available for ordinary health care, it simply means that basic maternal health care is not available, contraceptives are not available, access to abortion care is limited, access to post-abortion care is limited.
There are fears that unless urgent measures are taken to ensure women enjoy all rights, including safe abortions, post-abortion care, access to contraceptives and timely antenatal care, healthcare systems on the continent will be overburdened post-COVID-19.
They must prioritize provision of sexual and reproductive healthcare services for women and girls so that, one, they protect the health system for greater strain in future, because if you provide comprehensive reproductive health care now for women as you respond to this pandemic, you are actually enabling the health system to survive in the near future.
Most at risk are women in conflict countries as well as those in low-income countries. Sarah Kimani, SABC News, Kenya.
Women are at the heart of care and response efforts to the COVID-19 pandemic. Just look at the frontline responders, from the health professionals, scientists in search for vaccines, community volunteers, agricultural and other essential workers. But the crisis has also further exposed the vulnerabilities faced by women, including in their own homes through the abuse by close partners and family members. And as we examine the best practices around the world in response to the coronavirus, we ask whether women leaders are showing the way. SABC News' Sharon Briceby spoke to the head of UN Women, Phumzile Mlambo-Ngcuka, about these and other issues.
Dr. Phumzile Mlambo-Ngcuka, thank you for the opportunity as always, and good to see you.
Good to see you too.
You participated in a virtual event this week to mark Africa Day. The theme, African Women, You Are Unique. What was your message to the event in that regard?
Well, I celebrated African women for being resilient. I saluted African women health workers, like all the other health workers in the world, for keeping us safe and for shouldering the response to this pandemic. I also saluted and highlighted the fact that most African countries have economies which are largely informal. and women dominate in the informal sector in Africa. And it means that they are the ones who actually are the barrier between extreme poverty and a relatively survivable way of life. If you were to remove women in Africa, in most of the countries, no amount of commodities and any other economic activities that exist in most of our countries would be able to keep our nations in check. And they do all of that with very little return for themselves, with very little access to basic services such as water and sanitation, as we have seen in this pandemic. And whenever they are called to take action, as they have been called now by the Secretary General to respond to the call of the global ceasefire, women in DRC went straight to the rebels to tell them, hey, Nina, put down those guns. And they face them in their faces. Women in Central African Republic have done just that. Wow. Women in Burundi have stood up and said, we want peace in this country and we're going to fight these elections. And they won in many numbers than we've ever seen before. Same in Mali.
So in many ways, women are at the forefront of this call for silencing the guns by 2020. I mean, this deadline is beckoning.
Yes. And young women too are playing a critical role, from using technology to using the traditional way of organizing people.
And yet, Executive Director, in times of crisis, from conflicts, natural disasters, pandemics, you have the most profound effects on women and girls, who are historically society's most vulnerable. What are you seeing in terms of the role of women and the impacts on women during this pandemic globally?
Well, in addition to the fact that women are showing up to play their role, women also are highly exposed because there are so many of them who are working in the sector. 85% of them are nurses. More than 80 of them are in the other ancillary services in hospitals, such as cleaning and cooking. And the majority of health workers who have died from, the majority of health workers who have died are women. So women are dying from work more than, patients who are predominantly men who go into hospitals because of the disease. Women die because they are helping the patients to survive. Women also are at higher risk of poverty and food insecurity, because their way of trading in many African countries especially is informal, and they are in the open air. In lockdown, you go in, you cannot be in open spaces, and that has affected them profoundly. They don't have savings, they are in unsecured jobs, and they are therefore able to enforce contracts in a time like this, not unless there's an orchestrated a way of addressing their needs from government and other stakeholders.
UN Women has said that the pandemic underscores, and I think this speaks to what you've just been talking about, underscores society's reliance on women, both on the front line and at the home, while simultaneously exposing the structural inequalities across every sphere, from health to the economy, security, and social protection. To what extent has this pandemic reversed some of those gains, those hard-fought gains that have been made on some of the core issues under your portfolio?
Firstly, I must underline that there is no pandemic that is gender neutral. And this pandemic is no different two of the gains I want to highlight that are at highest risk of being reversed. Girls' education, which, as you know, Sherwin, I talk about this all the time because it is so important, and we fought for girls' education in the last 25 years since Beijing, and profiling the needs of a girl child, fighting child marriage. If girls are not at school, we are at risk of increasing child marriage, trafficking of girls, and early pregnancies, and some girls would not go back to school. So I am quite concerned about that challenge. Secondly, maternal health. You know that in the last 20 years, one of the areas where we have seen some progress is in the area of decreasing maternal deaths.
Right.
With hospitals being full and other patients who are non-corona patients struggling to have access to hospitals, women giving birth are at risk of having to give birth to these conditions that in the last 20 years we have fought so hard to improve. Now, this is something, therefore, that we are constantly raising, and I'm glad to see in South Africa that the minister has been talking about the importance of not neglecting other health needs that society has. But for women, maternal health is one of those that is really in danger of being affected.
So you've mentioned girls' education, fighting child marriage, trafficking, maternal health. What about this one? I was looking through some of the data in terms of just the domestic violence, which shows an increase since the lockdown, 33%, Singapore, 30%, France, 25%, Argentina, while we've also seen a massive spike in South Africa. It's fair to say that one pandemic has really exacerbated the other pandemic, not so?
Yes, absolutely. Men's violence against women is a shadow pandemic. We need to be talking about flattening the curve of coronavirus as well as the curve of gender-based violence, because violence against women will exist even after corona, which means we have to intensify the fight to end the violence against women and stay with the fight beyond coronavirus until we actually have reached a point where we have been able to tackle it. We have seen in some countries governments taking away the resources that were supposed to go to the fight against violence against women and taking it to address the needs that they have for addressing coronavirus, taking shelters that are meant for women who need to go to secured places and using them for isolation. And this is another area where we are reversing gains that were already made. We are actually calling for more resources to go to women, to women's shelters, to hotlines, to
As
NGOs.
part of the COVID national plans, right?
As part of the national plan and beyond, because we want this to continue. It should have been there. It has been, there's a violence that's been exacerbated under coronavirus, and the response must stay and help us beyond coronavirus. And we are seeing that in some of the countries, however, I must say, they have increased the resources for women. And we are also calling for countries to declare the services that women need to survive this violence essential services, so that women have a passage out of home to seek help, and those who are providing help have a passage into the home of a woman to assist the women. I have been calling all governments in the world.
Has South Africa's plan included some of the details you've just expressed?
Yeah, well, yes, the services that are for women are essential, but obviously we need more resources because the need is just so great.
Let me jump in here with another one. We often hear politicians and international civil servants talking about the need to build back better, build back smarter,
That
build
includes
back
me.
greener. People you know, yes, people you sit around a boardroom table with the executive director. What about women and girls? What should happen now moving forward as we begin to slowly emerge from restrictions and lockdowns around the world? We want to build back greener, but what do we want to do in terms of the women's rights movement?
Building back better means we're not going back to the status quo, to the old normal. We keep on talking about new normal now. New normal must be really new. It must not be the way we were pre-corona. So when we are talking, for instance, about violence against women that we were talking about, it must mean significant investment and intensification of the fight to end violence against women. It must mean that access to water and sanitation in schools, which affects girls so much, becomes something that is solved forever because it's been an unfinished business since the MDGs. It also, building better also means digitalization and closing the digital divide in communities, but also between girls and boys, so that every child, wherever they are, is able to have access to virtual learning. It should not be an afterthought. It should not be an isolated intervention. It has to be universal access. And building back better, it means primary health care that works so that people are able to get services closest to where they are and they can have easy access to continuous support for their health needs. Midwives to begin with in communities, and of course, tertiary care as well.
Yeah, it's a broad spectrum. It's, it needs a lot of resources, certainly. Let me ask you a final question, Executive Director. Several publications recently highlighted leaders who have done a good job in managing the response to this crisis. I'll mention a few of them. Prime Minister Jacinda Ardern of New Zealand, Germany's Angela Merkel, Finnish Prime Minister Sanna Marin, Denmark's Mette Frederiksen, Norway's Erna Stolberg, and Taiwan's President Tsai Ing-wen. What do those names tell us, and what's the lesson we should learn here?
Well, trust women. But I want to add also the Prime Minister of Namibia and the President of Ethiopia, two countries in Africa that are also managing the pandemic, and those two women are also in the leadership of those countries and leading the response of their countries. Women also tend to be focused on the issues, eyes on the ball. They are not distracted by politics, which have nothing to do with the response. They are actually quite good at mobilizing society to hold on together in a time of crisis. They are used to multitasking. I think they also have a good sense of what you do to have a family and a people-centered approach. Because when you're dealing with a health pandemic and people having to grapple with their mortality, this is something that affects families. And women know how to straddle between hardcore, dealing with policies, security, and also being very close to people and people's needs and understanding how they feel as mothers, as parents, as children. As you know, the Prime Minister of Norway even had a press conference for children just to help the children understand what this was all about, because children were scared and confused.
Well, I'll tell you, trusting women is a great way to end any discussion. Under Secretary General and Executive Director of UN Women, Dr. Phumzile Mlambo-Ngcuka, as always, thank you so much indeed.
Thank you so much.
And welcome back. The coronavirus outbreak has the world in tenterhooks as it has brought under the spotlight Africa's healthcare capacity and the continent's resilience and potential. 54 countries on the continent have so far recorded more than 100,000 COVID-19 cases and just over 3,000 deaths, as we've indicated earlier on. While the numbers continue to climb, the continent's leaders have been hailed for stepping up to the challenge and immediately taking measures to save the lives despite the weakened environment. Now we're joined by the Chief Executive of the South African Institute of International Affairs, Elizabeth Seropolis, who's joining us via Skype. Elizabeth, good evening and welcome to African Perspective. Let's first of all hear your impression of how the continent was able to respond to COVID-19.
I think around the world, people are commenting on the fact that the continent has actually responded very quickly and quite effectively. Certainly in the initial phases, I think we still have a long way to go before we've seen the last of COVID-19. But certainly I think there's a strong sense also within the continent and outside that the continent took measures early on, partly because I think there was a recognition that we had health systems that would not have been able to deal with a huge influx of infections. And so there was a coordinated regional response, which I think we haven't seen in many parts of the world. Certainly I was speaking to colleagues from Latin America today, and that hasn't been the same in Latin America at all.
And what would we attribute that to?
I think African leaders, and certainly also in our own country in South Africa, recognized how dangerous this could be if actions were not taken, if we didn't listen to the science and to the experts, and to move pretty quickly. And I think it was important to also see how both the African Union and the Center for Disease Control in Addis, the CDC, as well as the chair of the AU, President Ramaphosa, actually coordinated, brought together countries, initiated the discussion around the importance of debt rescheduling for indebted African and indeed low-income countries. And I think it was really learning from how other countries had not done things. And actually try to do that, to take correct actions on the continent.
I have to say that it was quite impressive seeing how, for instance, with the continent being able to mobilize resources, and of course the president coordinating that, and how the continent has been able to engage global players as well. When we speak about the IMF, for instance, and saying that we have a problem here in various countries, let's delay repayments.
I think I think the first steps have been extremely positive, but it's also the case that certainly if we're talking specifically about the issue of debt, that extending it and delaying it until the end of the year, by all accounts, will not be sufficient. That there needs to be additional measures taken on that count, particularly with regard to the bilateral and multilateral donors. There is another dimension which is currently in play, which is of course the important discussions and negotiations with private creditors, because a significant amount of some of that debt is also relating to private creditors. And then there's another category, and that's decisions and frameworks around how you deal with the challenges and the fiscal constraints that middle-income countries are having to balance between dealing with the response, the necessary response around the health pandemic, as well as then having these huge fiscal constraints, as well as mounting debt.
So in addition to the agreement that the various countries have been able to conclude with these financiers, including the IMF and the World Bank, what else do you think then should happen? Because when we speak about the impact of an economy or on an economy, is that you'll feel the impact now, but what people don't tend to forget is that there is the ripple effect. For instance, what we saw back in 2008, and some are even arguing that countries like SA are still struggling to recover from the 2008 blow.
Yes, absolutely. I think a number of countries are not in a position today that they were in 2008. And certainly our own economy here in South Africa was in a much stronger position in 2008 to be able to respond to the Great Recession than we are in a position to do today. I think one of the biggest challenges that African countries and other developing economies are very alert to is the fact that many of the developmental gains of the last 2 decades could disappear. Yeah. Depending on how prolonged this virus is. The problem with this virus is that it has exposed existing fault lines. It has accentuated trends that we have seen both in the continent and elsewhere in the developing world. And so the measures that have to be taken have to be quite significant. So if we're looking, for example, at the issue of debt, many of the studies and the modeling that has happened over the last few months emphasize the importance of at least pushing those out until the end of 2021. That's only that is part of the solution. It's not the only solution. How quickly economies can ramp up and can get moving again, the extent to which we can pick up momentum again on some of the continental initiatives around, particularly the continental free trade area, and the related effects on manufacturing, on regional building up, regional value chains. These all create some of the opportunities to get our economies kicking back into motion. The biggest challenge that African countries face is that we have such a huge informal sector, which has really been very, very adversely impacted by the lockdown and the related factors.
And what would the impact of that be? And just looking, for instance, at one of the studies and results that came out, looking into how the continent would be affected by COVID-19, and some of the predictions are that the economy of the continent could contract by at least 5%.
Yes. There are, specific sub-dimensions of that. One of that is, of course, that globally investment is going to reduce significantly. I think we're looking at anything between 30 and 40%, if not more, and a significant reduction in flows into Africa. Already mentioned the challenges around trade and the significant contraction in global trade. We've seen the slump in commodity prices, not least of all in oil. And the fact that governments now are having to re-budget and reallocate their budget to deal with the pandemic. That, of course, in a positive vein, can also be a great opportunity. So we have been talking about how you're able to leverage the limited resources you have in order to deal with some of the issues around sustainable development goals, whether we're talking about climate change or we're talking about agriculture and food security. Well, this does potentially create a possibility and an opportunity for some of these difficult decisions previously. If you're talking also about a more green economy, the huge stimulus that states are sort of acting, are putting into countries, the fact that they're also able to access funding from other international institutions creates an opportunity for African countries actually to tackle some of these difficult developmental objectives which previously might not have been possible, or we would never have thought about the kind of stimulus that has gone into these economies now. We would never have thought of doing that to sort of give a bit of a push to the SDGs. Now is potentially the opportunity, but I'm not quite sure whether all countries are going to necessarily take the bull by the horns in regard. And if they don't, then I think we're in for a difficult few years, not just the next 18 months.
And what we've seen on here on the continent as well, if you make an example, for instance, between South Africa and Zimbabwe, is that once one country, for instance, does not come to the table, does not make sure that its economy is fertile enough to create jobs, you will lose your human capital, which then flee to other countries, including South Africa, which then, of course, also leads to another conversation around the burden that some of these countries would be facing if the neighboring countries are failing to make sure that the economies recover from COVID-19.
Yeah, I think that's the critical lesson of the pandemic. This is about coordination. This is about cooperation. This is about the fact that the weakest link affects the entire chain, and that is as much about tells us as much about the importance of regional cooperation in terms of both Southern Africa as well as the African Union, but also more generally, more globally, the discussions that we've seen taking place about the decline of multilateralism and the fact that countries are focusing on their own country, and it's me first, and if I get the vaccine first, I'm going to keep it for my people. I mean, walls. The virus doesn't care about walls. The virus doesn't care about color, religion, nothing. It does seem to affect, and this is an issue, and this is what is of great concern in Africa, the ones who have the least means, the more marginalized, the vulnerable, because they don't have the resources to actually be able to protect themselves. And so that's the central message, and that's the message that we have to learn at a national level in terms of the importance of collaboration, and that it's not about me, that this is about Ubuntu.
Yeah.
If we're going to get philosophical about it, but it's also important to facilitate and to push for regional cooperation, strengthening regional institutions, continental institutions, to be able to play that important binding role. And then lastly, also to do what we can as Africans in partnership with other countries around the world who share the same values around the importance of multilateralism and international cooperation, to make sure that we don't end up, in a zero-sum game in terms of the kind of world we end up living in the next 10 years.
Then for South Africa and how South Africa's foreign policy is drafted, and where South Africa actually finds a lot of joy, a lot of people listening to the country at the moment, and we're seeing that the WHO also applauding how the country has responded to COVID-19. With that sense of potential influence that South Africa currently holds, how can we then position the country to make sure that not only the country benefits, but also the entire continent could benefit, and the continent is not kept out of economic conversations around how the entire globe recovers from COVID-19?
I think South Africa does have an important role to play there. Of course, let's not forget that we're also one of the permanent members of the G20. The African Union, of course, the African Union Development Agency have observer status in G20. And I think within G20, South Africa has played a critical role in creating greater sensitization around the challenges that developing economies face, specifically Africa, but also low-income countries. I think South Africa has also historically been a very active and engaged member of the IMF and the various committees of the IMF. That's important, and of course in the World Bank. I think there is a movement happening at the moment at the UN, led, I think, by Jamaica and Canada. This was pretty recent, about trying to mobilize greater support for developing economies in terms of the impact of COVID-19. And I would imagine that South Africa would have an important role to play there. Clearly, we're of course still serving on the UN Security Council, although that the Security Council hasn't really led on these issues for understandable reasons. I think the Security Council itself faces some challenges in terms of
Between
working
the
as
three.
a team. Yeah. But I think there are no, and the fact that we're, of course, chairing the African Union, I think already there with the AU Commission and with a number of other African countries, South Africa has already helped to lead the charge, so to speak, in terms of getting African and developing economy issues onto the global agenda.
You mentioned the African Free Trade Area Agreement earlier on, and looking at, for instance, BRICS and the BRICS Bank. Do you think that there is potential for the BRICS Bank to play a springboard type of role to try and spur on these economies as we start lifting some of these lockdown regulations?
Well, as far as the BRICS Bank is concerned, at this point, the countries that are receiving loans are in fact the founding members. There is a potential, of course, for this to be rolled out across the regions where these to which these countries belong. But as things stand now, that's not the case. There are the continental free trade area, of course, has been put on hold as a result of COVID. It was supposed to be to sort of come into effect the first part, in fact, next week, next Monday. That's been delayed for understandable reasons. I think there is also the challenge of bandwidth of African leaders. I think it is important, though, to make sure that that certainly once this first phase of the pandemic is past us, that we get back onto the business of the continental free trade area, because I think that has significant potential to really create regional integration in terms of being able, countries being able to produce and trade among themselves, produce goods, value-added goods, and trade among themselves, which is also going to be one of the consequences of COVID-19. We've heard the term reshoring, the concern that many key strategic goods are being produced by too few countries. China is the one that obviously comes up both in terms of pharmaceuticals and active ingredients, as well as in terms of the production of masks and so on. And so many countries around the world are saying now we need to diversify. We need to, some of them are saying, well, everything needs to come back home. But I think a number of others are also recognizing that it's important to have these production facilities not just concentrated in one country. And I think there's Africa, through the African continental free trade area, does provide a number of opportunities to be the host of, to encourage investment into countries, to be able to generate the kind of secondary industry that we've been wanting to do.
Okay, thank you so much for that. There you have it from the Chief Executive of the South African Institute for International Affairs, Elizabeth Siradopoulos, speaking about what potential is available on the continent. When we come back, we give you let's say a nice tune, somebody that you've never thought could sing, just after this. And welcome back. You're still watching African Perspective with me, Aldrin Simpier. Lesotho's Prime Minister, Dr. Mokete Majoro, says he is ready to mend relations in his party and also unite Basotho in general. Speaking exclusively to SABC News, Majoro also said that the law must take its course in all matters.
Have you reached an agreement with former Prime Minister Tom Thabane not to face charges and the First Lady? Is it true?
No, definitely. We have not reached an agreement with that. The important thing is we need to create credible institutions, and governments need to stay clearer from these institutions. All individuals are innocent until credible judges can declare them guilty or not. And cases that are before the courts that are related to my leaders will probably have to go through the mill, And so there's a judicial process that will probably run properly. We must make sure that it is credible. At this stage, there is no specific arrangements that we are having. But I need to go and visit my own prime minister, former prime minister, and have a discussion with him. But although some did not notice, is one man that I have respected for many years, and I would like to spend some time with him. He has been my mentor before, and those who know him, we can sit down with him and enjoy a conversation. So I will take the initiative to go and talk to him. What I would like to happen is that now that he has proceeded to retirement, I would like that he enjoys his retirement without any other problems. I think he has served the public of Lesotho distinguishably, and he needs now to retire in peace. But that's a discussion that I will have with him in future.
Shouting out to the world to hear this song, and I'm ready. I'm shouting out to the world to sing this song of peace. Let the rain come wash away our sins and make us new again. Let the people come around and become one nation, Africa. I'm shouting out to the world to hear this song, and I'm ready. I'm shouting out to the world to sing this song of peace. Let the rain come wash away our sins and make us new again. Let the people come around and become one nation, Africa. Let the rain come wash away our sins and make us new again. Let the people come around and become one nation, Africa. New again. Let the people come around and become one nation, Africa. I'm shouting out to the world to hear this song, and I'm ready. I'm shouting out to the world to sing this song of peace. Let the rain come wash away our sins and make us new again.
Well, yes, that is her. You're not mistaken at all. And Ntakwana Ngatane, former colleague. Ntakwana, do I say singer, songwriter, journalist, using your voice now on music? Good evening and welcome to African Perspective. Tell us about this talent that so many people are seeing for the first time.
Well, many people may be singing for the first time, but you're not. I sang for you when you were leaving SABC. So now I don't know if I should sing again, because you might just be...
No, I'm convinced that you can sing, and even from the previous video that you sent me before, I am convinced that you can sing. But where does this inspiration come from? And in this song as well, One Nation Africa.
Look, Aldrin, I've always been singing for as long as I can remember. But I mean, it's always taken the back seat in all of the things that I've done. But I think in terms of this particular song, the message is quite clear. We're born in the most beautiful continent in the world, you and I. And usually we are separated by borders and by traditions and by cultures, and yet we are one people. And so if we can realize the strength that lies in us as Africans coming together and realizing that we are one people, we are one nation, then the wars will stop and the disease, we will be able to tackle COVID-19 and others. And we will develop economically as a continent.
And as a journalist, of course, you would have intimate insight as well to the lives of Africans on a daily basis, but also how our politicians lead their lives as well. And do you think at all that is some of the aspects that inform your level of spirituality, some may argue, and even when you say that this is what I'm putting now, pen to paper?
Look, absolutely, because our politics divides us more than it brings us together. And our politicians thrive on us being divided as a people. And so that divide and rule has for so long caused conflict on this continent, but it must stop. And it's up to us as individuals, it's up to us as those who write, it's up to us as those who document and those who observe, and ordinary citizens of this continent to realize that we go beyond what the politicians tell us we are, the divisions that they bring among us so that they can rule us. And we go beyond that, and we must, as a people, come together for our continent to realize its potential.
What we saw during colonialism and here in South Africa during apartheid as well is that musicians, for instance, took up an activist role. And this has been an argument from a lot of people saying, where are the musicians to take up that activist role? Is that what you're doing?
I would like to believe so. A lot of the songs that I write stem from the sort of world that I would like to see, not only in my country, Lesotho, where I come from, but also the continent of, our continent, Africa. I think that the more messages we put out in terms of what we would like to see, the dream that we would like to see, the beauty of Africa that we would like to see being realized. I think this is where most of my music comes from. And some of it comes from sadness, because even though we entertain, we also want to express the sort of things that we do not want to see, the sort of things we don't want to forget, the sort of things that we can forgive but not forget. So a lot of what we should do as musicians, as writers, and as documentarists or people who document in whatever way, whether in music or poetry or even in journalism, I think a lot of what we do should inform the sort of dream that we have, the Wakanda that we want on our country.
Should we expect a book?
Absolutely. Okay. I think people have been asking me for so long to write a book, particularly on Lesotho, because I've worked so much on Lesotho for so many years. I think that's coming. Okay. But I think also mostly, Aldrin, having been in South Africa now for the past 3 or so years, I find that I'm a lot more interested in how we look at each other as Africans. And so I think that also is coming.
Yeah, well, there you have it from Ntakwana Ngatane. Beautiful voice, I have to say. And indeed, she once sent me a video clip of her singing. Wasn't too sure about the singing back then, but I'm sure that she's done a lot of work on that voice. A beautiful voice there, and thank you so much for watching African Perspective with me, Aldrin St-Pierre. We're back again next week, same time, same place. Enjoy the rest of your week. Goodbye.
Come wash away our sins and make us new again. Let the people come around and become one nation, Africa. I'm shouting out to the world to hear this song, and I'm red. I'm shouting out to the